Many women believe that menopause is something you just have to get through, that the symptoms are inevitable, and that suffering is simply part of the process. But I have to be honest, I call foul on that because that simply isn't true. Menopause does not have to be a time of pain and suffering. What if many of the symptoms women experience during menopause are not something you have to just accept, but something we can actually treat and improve? And what if menopause isn't a time for suffering, but a time for thriving? In this video, we're talking about why menopause can leave you feeling out of control and what actually works to help you get back in the driver's seat. You may have been told this is just part of aging, or your labs are normal. Maybe you were told that labs are required before starting hormone therapy. Maybe you heard it will pass. This is only temporary. But meanwhile, you're dealing with things like hot flashes that disrupt your day and your sleep at night, poor sleep and constant fatigue, brain fog that makes it harder to focus, weight gain that doesn't respond to what used to work, joint aches and pains, increased anxiety, or even new onset panic attacks, or mood changes that can range from irritability to feeling overwhelmed to unexpected episodes of crying, with even more symptoms layered on top of that. And at some point, it can start to feel like you're losing control of your own body. Hi, I'm Dr. Terri Malcolm, a board-certified OB-GYN, menopause specialist, and fitness and nutrition coach. I help women navigate perimenopause and menopause using medicine, movement, and lifestyle strategies so they can feel strong, energized, and confident in midlife. The idea that women have to suffer through menopause is a myth. Yes, menopause is a natural transition. It's a normal biological process. Menopause can also occur due to surgery, such as removal of the ovaries, or as a result of medical treatments like chemotherapy or radiation. In the United States, about 1.3 million women become menopausal each year. And because women are living longer, we now spend nearly 40% of our lives in the post-menopausal years, which for many women is more than 30 years. So menopause and post-menopause are not a short phase of life. They are a significant portion of our lives. And during this time, the symptoms many women experience are driven by very real physiological changes in hormones, metabolism, sleep, and brain function. For 10 to 15% of women, symptoms like hot flashes, brain fog, mood changes, and irritability can persist long-term, even for life. And there's another condition that we could dedicate an entire video to. That's genitourinary urinary syndrome of menopause, or GSM. GSM refers to changes in the vaginal, vulvar, and bladder tissues that occur as a result of declining hormones. Let me know in the comments if you'd like me to make a video about GSM. Even if symptoms aren't always reported, these changes are happening at a cellular level for all women in menopause. So when we step back and look at the full picture, it becomes clear. Menopause and the associated symptoms are not something to dismiss. It's something to understand. And once we understand what's happening in the body, we can make informed, personalized decisions about how we want to support our health during this stage of life. So what do you need to know about menopause and menopausal care? First, hormonal changes are real. We're born with a finite number of eggs, and as that egg supply declines, estrogen and progesterone levels begin to fluctuate and eventually decline. These hormonal changes affect multiple systems in the body, including the cardiovascular system, musculoskeletal system, genitourinary system, and even brain function. And that's why women may experience symptoms like hot flashes, sleep disruption or insomnia, new onset anxiety or panic attacks, vaginal dryness or itching, pain with intercourse, brain fog, or difficulty concentrating. These are real physiological changes, not something you're imagining. Number 2, women's symptoms are often dismissed. Many women are told their symptoms are normal or that they are too young for menopause. 25 to 40% of women report having their menopause symptoms dismissed ignored, or misdiagnosed by their healthcare provider. And while menopause is a normal transition, there is a wide range in how women experience it. Normal does not mean you have to suffer. Symptoms are signals, and they deserve thoughtful evaluation. Number 3, there are safe and effective treatment options. We now have a wide range of evidence-based options available to treat menopausal symptoms. This can include hormone therapy, commonly referred to as HRT or MHT, menopause hormone therapy, which for the vast majority of women is safe and is the most effective treatment for menopause symptoms. There's also non-hormonal prescription treatment options for vasomotor symptoms that are FDA approved. A combination of lifestyle strategies and, when appropriate, prescription medications that are also both safe and effective in supporting metabolic health. And strength training to help preserve muscle, energy, and long-term health. There is no one-size-fits-all approach, and that's why personalization matters. Number 4, the body needs a different strategy. If you're in the over 40 club, you've probably figured out that what worked in your 20s and 30s will not work the same way during midlife. Eating less and moving more, chasing the latest trend or supplement, or just waiting it out, that's not what's going to get you where you want to go. That doesn't mean your body is failing. It means your body is changing and it needs a different strategy. So what actually helps? Here are 3 things that make the biggest difference. First, understand your options. Start by understanding what's available, both hormonal and non-hormonal treatments, so you can make informed decisions about your health. For me personally, I chose hormone therapy. I started at age 48 with estrogen and progesterone. A few months later, I added testosterone. My symptoms are now manageable because I have a treatment plan that works for me. And that's what I want for my patients. Not a one-size-fits-all approach, but a plan that's thoughtful, personalized, and aligned with your goals. Number 2, support your metabolism. Supporting your metabolism becomes especially important during midlife. These include things like strength training 2 to 3 times per week, prioritizing protein with each meal, and building lifestyle habits that support sleep, recovery, and overall health. For me, I strength train regularly. I prioritize 30 grams of protein at every meal, and I focus on mostly whole foods along with movement and rest. Not because I have to, but because these strategies help me feel strong, energized, and well. And number 3, work with the right clinician. One of the most important factors is working with a clinician who understands menopause and who takes your symptoms seriously. I remember when I saw my gynecologist and I said, I'm in perimenopause. I'm having hot flashes, night sweats, and irritability, and I'd like to start hormone therapy. She said, I hear you, and we created a plan. Well, actually, I told her what I thought my plan should be, but my point is this: there was no dismissal, no unnecessary barriers, and no need to rely on labs to diagnose perimenopause because diagnosis is based on symptoms. And I believe that every woman deserves the experience of being listened to. That's exactly what I want for my patients: to feel heard, to feel validated, and to be offered a thoughtful plan using a shared decision-making approach. The key takeaway is this: you do not have to suffer through menopause. Menopause care is about minimizing disruptive symptoms and helping to prevent long-term health risk so you can feel well, not just get by. Your body isn't broken, but it is changing, and it deserves a thoughtful, personalized approach. And when we understand the physiology of midlife, we can stop normalizing suffering and start approaching this stage of life as a time to thrive with better health, better energy, and better outcomes. If you found this helpful, please like the video and subscribe to the channel. My goal is to make sure more women have access to clear, science-based information so they can navigate midlife with confidence. And if there's a topic you'd like me to cover, leave it in the comments below. I read and respond to every comment, and when you come to this channel, I want you to feel informed, empowered, and strong. Thanks for watching. Farewell until next time.